would like to thank Alexion Pharmaceuticals, argenx, Horizon Therapeutics, Janssen Pharmaceuticals, Regeneron, and UCB for their generous support of this symposium. Next up, we will hear from Dr. Kathleen Yoder, Director of our Medical Education here at the MDA. Kathleen arrived at MDA just under 2 years ago after serving as a medical director for a healthcare communications agency. She earned her PhD in behavioral neuroscience from Rutgers University and completed additional postdoctoral studies at Johns Hopkins. She is originally from Scranton, Pennsylvania, and now lives in New York City with her husband and her 1-year-old son, who just started walking and is on the go. Dr. Yoder has been working closely on the results of the MDA Economic Burden of Care survey in MG, and will be sharing with us an overview of those findings. So without further ado, I will turn it over to you, Dr. Yoder. Thanks for being here.
Hi, Marissa. Thank you. And I just want to kick it off by saying, can you hear me okay, Marissa?
We can hear you.
Okay, sounds great. Just sharing my screen. I just want to kick it off by saying it's been quite a pleasure to be here at MDA. This is a project that was a super great example of collaboration, both across teams here at MDA as well as outside of MDA. And I'll get into that when I go into the background of the study. But I just want to make sure I acknowledge that this work was accomplished in no small part by the effort of many, many people. And so I want to just make sure that that's well known, and as well as make sure that I acknowledge the patients and the families who participated in this survey. Many of you on the line may have actually been some of the participants. So I hope that you see yourself in the data that I'm about to present, and feel free to ask any questions. I can't promise that I'll be able to answer them. I wasn't involved in the initial development of the project itself, but I will do my best. So without further ado, let me figure out how to advance to the next slide. There you go. So in terms of the background, as we know, having and caring for obtaining care for any disease, particularly the rarer diseases, can be costly. And so what we knew going into this was that many times people studying the cost of diseases rely on claims-based analyses using, so they look at annual healthcare claims that have been submitted to sort of get at how costly the burden of having a disease is from a very almost objective, capturing it in a very objective way. What we wanted to know was not only the costs that people with MG encounter in their daily life, but also the impact of those costs. So that was the true rationale for conducting this survey, was to understand the cost burden of MG among patients and their families living with the disease, as well as some of the more subjective experiences of what does it mean to pay those costs. So in terms of the survey design, I should know, I had it on the original slide there, but that this study was actually sponsored by argenx. And so they provided funding, but they also helped connect us to what an organization that they have that's a collective of many different advocacy groups in MG. So you see them listed there on the right-hand side of the screen. And we worked with them to develop and to kind of hash out the key themes that we wanted to explore, and through multiple rounds of review, get at some of the key questions that would be included. One thing to note about the survey is that it was designed to take between 25 to 30 minutes to complete, so that it wasn't such a big time burden for people interested in taking the survey. The key themes that were nailed down were to define the direct and indirect costs. Direct costs meaning out of pocket. Indirect, we also asked about time. How many hours do you spend on the phone with insurance companies? How many hours do you spend driving from your appointments or time off work? That gets into, so those are direct and indirect costs. Employment and losses, so how much money and time is associated, are you losing to making these MG appointments? And, you know, as we all know, part of life is you may have kids who need to take out of school or provide extra daycare for, something like that. Financial decisions is another big topic we zoned in on. That, what did people have to sacrifice in order to be able to pay for the cost of their care? And then several questions about quality of life. How does living with MG impact those life experiences? So yeah, I also want to say that this is an initial dive into the data that we gathered. There's a lot of data, and we actually have a manuscript in preparation to explore in more depth some of these findings. So be on the lookout for that. But this is just a sort of bird's eye view of the findings. The survey was actually distributed. It was developed last year and distributed between October and December, and it was sent out through several channels. And we really wanted to try to get as much response as possible. And so we worked with the different advocacy groups and on the argenx Advocacy Leadership Council to get the word out that the survey was available, and to try to increase that response rate as much as possible. And we were pleasantly surprised with the results. So we got 1,058 respondents, many of whom I imagine some of you may be in the audience listening in, so this will be interesting for you. The majority, as you might expect, were people that were living with MG themselves, and 23% were caregivers. Something that's not represented on the slide, but I know offhand, is that the majority of respondents taking the survey on behalf of a person with MG tended to be their spouses or partners. And if you're wondering the background, who are these people who responded? You could see that they were relatively distributed across the country in the map on the left. There were slightly more female respondents than male, and the average age was 56. And as you could see there, most of those respondents tended to be over 35, with only a minority, 22%, under the age of 35. In terms of race or ethnicity, this is one of the key limitations of the study. Remember, I said that we tried to reach as many participants as possible, but there's work to be done because the majority of the respondents tended to be white, followed by Hispanic or Black or African American. And then their annual income, the majority tended to be earning under $75,000 per year, and 36% earning over. Another thing that we know is that the majority of respondents tended to have at least some degree of college education. So the true question, down to the objective of the study, what are the out-of-pocket costs that were reported? So here you see the costs represented across different domains. So we asked about health insurance, which you see on the top, the cost of caregiving. This is professional caregiving paid out of pocket. Non-medical items, assistive equipment, medications and treatments, medical care. So those are those doctor's appointments and visits that people are taking time to navigate and making time for in their lives. And then diagnosis on the bottom, which is a one-time cost, as opposed to the others, which are an annual cost. Overall, the families were paying around $16,000 out of pocket per year. That number is pretty variable. And the main drivers of those costs tended to be the health insurance premium or deductibles, the medications and treatments, and the medical care. You'll notice that professional caregiving is pretty high there as well. But the caveat here is that not all of the participants were able to afford professional caregiving. And so overall, the main drivers are those health insurance costs, medications, treatments, and medical care. And then among those who could afford professional caregiving, those were also high costs. Another thing that we noted was that there tended to be cost disparities. We asked about demographics, medications that people were receiving, and what the key themes that kind of surfaced were that people who were receiving infusions tended to pay higher out-of-pocket costs overall across most domains. So that was a big finding. And then the categories represented to the right, that people of color, female, lower income, and less educated, they had higher costs in some domains, but not all. This section not only did we ask about the cost, but we said, what are the related impacts? How are you feeling about these? How do you feel about your financial situation? And so you could see that about 40% of respondents felt dissatisfied with their financial health. One thing that wasn't included in the study was sort of a control group. So these are people and families who are living with myasthenia gravis. I'm curious as to whether what the response would be if you asked the general population how satisfied they are with their financial health. I'd like to know how similar or different it is, but who knows? On the right-hand side, you see that we asked about the major and minor, rate the following as either major or minor concerns, and you can see the costs of medications, treatment, medical care, and health insurance are among the top concerns across participants. And what's interesting about this is that those major concerns tended to align with those values that were presented earlier, that those major drivers of the overall cost of care. And then another thing that we asked was, what are some of the financial choices that you've had to make as a result of needing to pay for your MG care, which we know is expensive. And so across the top, we got a lot of responses in different categories. What's shown in the top graph and what's surprising and unfortunate is that many are spending some of their savings or retirement money to pay for care, delaying major life events like birth of a child or attending school, things like that, delaying a major purchase, not being able to pay off their loans, borrowing money, applying for some type of assistance, including government assistance, and then a smaller subset are reported having to go to charity, selling their belongings, putting off education, and other categories listed below the graph. Another aspect was about employment and job loss or sacrifices in their employment. And so we saw that at least 75% were reporting that their work had been impacted as a result of MG. And what you can see here is that the top bullets are people with MG, and the bottom bullets are the caregivers. So we asked again, as I mentioned before, that we asked how much time, did you have to take off of work, for instance, to commute to your appointments? Did you need someone to accompany you? And I think the answer was that over 50%, it's at least 50% of people who responded that said they needed someone to accompany them to their appointments to help them. And so what you see is that there's this kind of this downstream effect of people losing time from work, and in the sense that time is money, they're also losing wages associated with that, and that this loss of time and wages impacts not only the people that are living with MG, but also their caregivers. So to summarize the findings, we know that the economic burden, based on the results of this survey, the economic burden of myasthenia gravis is substantial. The average annual pocket cost reported for a family was almost $16,000. And again, these families have insurance. Over the majority of them were covered by health insurance. So this is a pretty high number, surprising. Those costs were mainly driven by medications, medical care, and health insurance costs. The disparities that were noted were among people receiving infusions, as well as some subcategories across different domains. An important point is that there were definitely limitations to this study. The respondents were all self-selected, so many people who received the invitation. It was up to them to decide whether or not to participate. And of course, there was a lack of diversity. So majority were white, some degree of education, and within a certain income bracket. So the next steps, we need to broaden our outreach to people of color within the MG community to better understand the burden in this population. The next steps are to share findings to a broader degree with the public. As I mentioned, we have a manuscript in preparation. We're drafting right now. And we're planning to submit that to a journal for peer review, to a medical journal. After that, we'd like to pull together a white paper summarizing the findings and get the word out as much as possible for things like the impact that MG is having on people's lives. That information, facilitating conversations with a boss. Perhaps you're a person with MG, or you're a caregiver of a person with MG, who is trying to make a case for, look, this is why I need this time off. Just give people a certain level of awareness of the burden that that people are encountering as a result of needing to pay for and attend medical appointments. And so I think I covered everything. There's a lot, like I said, there's a lot of data included in the survey results, and this is just a bird's eye view of what's to come. So we're working on it, and we hope to be submitting by the end of this year. And it's an exciting project to work on. And again, thank you for allowing me to share this with you, and be on the lookout for that. We'll send some updates out from that you'll be receiving from MDA once the paper is, fingers crossed, accepted, and just look out for more on that front.
Thank you so much, Dr. Yoder. We appreciate you being here today.